Experiencing unprotected sex can bring a rush of emotions, and often, a lot of questions about what to do next. It is completely normal to feel concerned about potential exposures, especially regarding serious infections like HIV. Knowing your options and acting quickly can make a significant difference in managing these worries and protecting your health. The direct answer is no. Post-exposure prophylaxis, or PEP, does not always 100% prevent HIV infection after unprotected sex, but it is highly effective when used correctly. PEP is a critical emergency measure that significantly reduces the risk of HIV transmission, offering a vital window of opportunity for prevention. The effectiveness of PEP hinges on several key factors. Primarily, it must be started as soon as possible, ideally within a few hours, and no later than 72 hours or 3 days after potential exposure. This is because PEP medications work by stopping the HIV virus from replicating and establishing a permanent infection in your body during its early stages. Once the virus has had more time to spread, the medications become much less effective. The type of exposure and the viral load of the source individual also play a role, as does strict adherence to the prescribed regimen, which is typically a 28-day course of medication. If you have had unprotected sex and are concerned about HIV, the most important step is to seek medical attention immediately. Do not delay, as every hour counts within that 72-hour window. Contact a healthcare provider, visit an urgent care clinic, or go to an emergency room. Be prepared to openly discuss the details of your exposure, including when it happened and any information you have about your partner's HIV status. This information helps the doctor determine if PEP is appropriate for you. Understanding the mechanics behind PEP can provide additional peace of mind. PEP medications are antiretroviral drugs, the same type used to treat HIV, but they are deployed preemptively. They target specific stages of the HIV life cycle, disrupting the virus's ability to infect new cells and spread throughout the body. This emergency intervention is distinct from pre-exposure prophylaxis, known as PrEP, which is a daily medication taken proactively by individuals at ongoing high risk to prevent HIV acquisition. While PEP is not a guaranteed shield, it is an incredibly powerful tool in our fight against HIV transmission, especially when time is of the essence. Prioritizing quick action and diligently following medical advice are your best defenses if you find yourself in a situation of potential exposure. Remember that consistent prevention methods, such as using condoms correctly every time and regular testing, remains the most reliable ways to protect your sexual health.